Hello, my name is Maria Tucker, and I'm one of the registered dietitians with the Duke Center for Metabolic and Weight Loss Surgery. First of all, congratulations in choosing to improve your life through weight loss surgery. And thank you for choosing the Duke Center for Metabolic and Weight Loss Surgery to provide you with a service that will help you improve your life for the better. Today is your initial visit with us, and in this session, we will be talking about a lot of different things that will help you better prepare for surgery. One of the things we're going to be talking about are your goals. After weight loss surgery, there will be certain goals that you will have to achieve in order to be successful. One of them is consuming adequate amounts of protein in order to ensure that you maintain muscle mass and promote healing. You also will have to make sure that you drink adequate fluids to maintain hydration. You're going to be consuming adequate nutrients through vitamin and mineral supplements in order to maintain your health as you lose weight. And lastly, you're going to be learning strategies for nutrition success after surgery and also to help promote weight loss. With the nutrition component of this program, you will be seeing the dietitian at several different times throughout your weight loss surgery process. Today is your initial visit where we will be talking about some of the things that you can practice to help you prepare for surgery. You will also be learning about vitamin and mineral supplementation and set goals in order for you to better prepare for surgery. After today, you're going to be coming back to see the dietitian in the pre-op class. And in that class, you will be given instructions on how to follow a special diet that you will have to do to prepare you for surgery, and this is done about a week before your surgery date. You will also learn about the modified full liquid diet, which you will be using for 2 to 3 weeks after surgery. Once you have the surgery, you will be coming back to see the registered dietitian about 2 to 3 weeks after surgery. At this session, you will be learning about the next diet phase, which would be the soft food stage. You will also be assessed as far as how you're doing with your weight loss and how you're doing with your liquid diet and how you're tolerating the protein shakes and how you're staying hydrated throughout the 2 weeks. After the soft food stage, you will then be advanced to the regular food stage or the solid food stage, and that is usually done around 3 months after surgery. You will meet with a dietitian to help you transition into the different foods that you're going to be eating after surgery around the time that you're 3 months post-surgery. That will be the last diet advancement that you will get, and pretty much when you get to that point, you will be eating healthy. The restriction will mainly be on the volume and the portion size per meal. After your 3-month visit, you will then come back to see the dietitian at 6 months, 9 months, and 12 months. These visits are mainly for weight loss checks to make sure that you're losing the right amount of weight that we expect, that you're doing well, and that you're still continuing to follow the principles of weight loss surgery nutrition that you started with even before surgery. Before you came to the initial visit, I'm sure you completed a nutrition survey online, which is a self-assessment tool that we used, developed by the Academy of Nutrition and Dietetics, in combination with some of the questions that we dietitians here in the clinic developed. This helps your clinical team determine your readiness for surgery and allows us to assist you in having a successful outcome. The nutrition survey you completed is scored, and the score is based on several different components, including food choices, portion sizes, emotional and social eating, environmental cues, physical activity, awareness of hunger, and eating patterns. If you scored 51 to 100, then you are definitely ready for surgery and you will be cleared by nutrition. If you scored 26 to 50, then we may put you on an educational delay, which means that you will have to complete 2 weeks of food journals, which the dietitian will review in order to determine whether you are able to make the right changes to your eating behaviors and eating patterns to prepare you for surgery. If you scored a 0 to 25 on the survey, that tells us that you are not quite ready for the surgery itself, and you will be required to meet with a dietitian one-on-one in order to prepare you and get you ready for surgery. Now let's talk about diet progression. Your diet progression will go through different stages throughout the course of your weight loss surgery process. right before surgery, which means the day before, you will be on a clear liquid diet. The clear liquid diet consists of clear liquids, which are clear against the light, nothing with pulp as far as juices. You'll be able to drink decaffeinated coffee or tea, sports drinks like G2 Gatorade, Crystallite or sugar-free drinks, and water, of course, is a very important part of the clear liquid diet. The clear liquid diet is done the day before surgery to clear your bowels, and that is just to help prepare your bowels for surgery and to lessen the risk of infection. Once you have the surgery, you will be started on a modified full liquid diet in the hospital, which you will follow for 2 to 3 weeks. The modified full liquid diet consists of 2 different types of liquids. One of them are hydration fluids. Hydration fluids are fluids that are non-calorie, no caffeine, and no carbonation beverages. It can include water, sugar-free drinks, decaffeinated coffee or tea, but no sodas, even if it's diet. You will also have to meet 64 ounces of hydration fluids a day as your goal. Now remember that while you're in the hospital, you probably will not be able to get to your goal. But that's okay, as long as you work towards the 64 ounces of fluids throughout the 2 weeks of your modified full liquid diet. The other type of liquid you will be drinking are your meal replacement shakes or protein shakes. These consist of protein drinks that are pre-made, or you can also have powders that you mix with either water or milk. Your goal for protein shakes or liquid meal replacements is to have 60 to 80 grams of protein a day through those protein shakes, and also to have 500 to 600 calories a day. It's going to be very important for you to meet both, because if you get to your protein goal but not to your calorie goals, you will not be having enough energy to go about your day. So try to make sure that you get 60 to 80 grams of protein and 500 to 600 calories from your protein shakes. The best type of protein to use is whey protein isolate, because it is the best for maintaining and building muscle. If you would like to try plant-based protein shakes, then try to get something that has pea protein isolate in it, which is made out of yellow peas. After you finish the liquid diet, which you will do for 2 to 3 weeks, and you've successfully completed it, you will then be advanced to the soft food stage. This is done when you come into the post-op class, where you will be given specific instructions on how to transition to solid food using soft foods. And soft foods include things like eggs, soft scrambled eggs, flaky white fish, really soft cooked dark meat chicken or turkey, as well as tofu, tuna, and other things that are really soft to eat. You may also be able to eat soft cooked vegetables and canned fruit without sugar. If your food has to be cut with a knife, then it's not soft enough. So that gives you an idea, the types of food that you'll be able to eat on the soft food stage. You will follow soft food stage for about 3 months, and then you will return to see us at 3 months in order to transition to regular or solid food stage. After you complete the soft food stage, for about 3 months, you will return to see the dietitian to be transitioned to regular texture food or solid food stage. At this point, you will be allowed to eat pretty much anything except for high fat and high sugar foods. Your main restriction will be on portion size or volume. During the regular food stage, you will still continue to follow the principles of weight loss surgery nutrition that you learned even before surgery. You will also be making sure that you eat enough protein. Let's talk about protein. Even before surgery, you are going to make sure that you eat enough protein, because protein has several different functions. One of them is to help you heal well after surgery. Protein also helps your body produce hormones and enzymes that help you with your immune system. It also helps you feel full longer, because protein takes a longer time to digest compared to carbohydrate foods. Protein also helps keep your hair, skin, and nails healthy. Other functions of protein include encouraging your body to burn fat, so definitely it will help you with losing weight. It will also help preserve your lean body mass and prevents slowing down of metabolism. And it reduces hunger between meals. How do you increase protein in your diet? One of the ways you can do that is by adding an egg white to a scrambled egg if you're eating that for breakfast in the morning. You could also use unflavored whey protein or pea protein powder to soups. You can add that to cereals and other foods that you may eat that do not have enough protein in them. You can also replace sour cream or cream cheese in a recipe with non-fat, unflavored Greek yogurt, which gives it a nice creamy texture, but also adds protein as well. Vitamins and minerals. Vitamins and minerals are going to be crucial after surgery, but it is also important to start taking multivitamins even before surgery to help better prepare yourself nutritionally for the surgery itself. After surgery, you're going to be taking multivitamins that are chewable, liquid, or crushable. And that is to allow your stomach to be able to digest and absorb the nutrients from the vitamin mineral supplement that you're taking. Remember that after surgery, your stomach will be smaller and you will not have a lot of gastric acid being produced in your stomach. Vitamin pills are very hard to digest. In order to make it easy for your stomach to digest the vitamins and minerals, it is important to take chewable or liquid multivitamins. Right after surgery, for somebody that has gastric bypass or sleeve gastrectomy, you will be required to take chewable, liquid, or crushable multivitamins that contain 400 micrograms of folic acid, 18 milligrams of iron, and 15 milligrams of zinc. If you're taking over-the-counter chewable multivitamins such as Flintstone Complete, Centrum Kids chewables, you will be required to take double the dose of the vitamins in order to obtain the right amount of nutrients that you need. If you are using bariatric-friendly multivitamins, then you will need to follow the directions on the back of the bottle. You will be taking your multivitamins right after surgery once you get home, and you will do that for 2 to 3 weeks, after which you will then add calcium citrate and vitamin B12. Calcium citrate is what we recommend because it is easier to digest, it does not require a lot of gastric acid for digestion, and it is easier on the stomach, so you will have less of the nausea and GI upset that might come with taking calcium. We require for patients to take 500 to 600 milligrams of calcium citrate 3 times a day in order to get the right amount of calcium that you need. The total calcium amount that you need would be 1,500 to 2,000 milligrams of calcium a day. You will also be required to take vitamin B12, either as a sublingual form, which means you put it under the tongue. You can also do weekly nasal spray for B12, or you can go to your primary care doctor's office for a monthly B12 shot. You will take your calcium citrate and B12, like I said, about 2 to 3 weeks after your surgery. If you have duodenal switch as your surgery, then you will be required to take a little bit different types of vitamins and minerals. You will still take multivitamins in chewable, liquid, or crushable forms in the same amount as gastric bypass or sleeve gastrectomy patients. You will also take calcium citrate. However, the amount of calcium citrate you will be taking is a little bit more. So for duodenal switch patients, you will be taking 1,800 to 2,400 milligrams of calcium a day, or 500 to 600 milligrams of calcium citrate 3 to 4 times a day. You will not be required to take vitamin B12, but you will be asked to take vitamins A, D, and K, either along with your multivitamins or in your multivitamin supplements, or as a separate supplement. It's best to take water-soluble or dry forms of vitamin A, D, and K because these vitamins are fat-soluble. And with duodenal switch patients, you may have some fat malabsorption and therefore not absorb these vitamins if you take it in the gel form. You are not going to be taking gummy vitamins. We do not recommend gummy vitamins because these vitamins are usually not complete and you will not be able to get the right amount and types of nutrients that you need. If you are having adjustable gastric banding, then you will need the multivitamins similar to the gastric bypass and sleeve patients that contain iron, zinc, and folic acid in the recommended amounts. We also recommend additional supplements. If you are a woman of childbearing age, or you've been diagnosed with anemia or have been told to take additional iron, you will be continuing to take iron supplements in addition to what is in your multivitamins. Another supplement that we recommend is biotin. Biotin is recommended to help prevent hair loss or minimize the shedding of hair, which happens around 3 to 6 months after surgery. It is best to take biotin supplements that are sold as hair, skin, and nail vitamin supplements because they contain additional antioxidant vitamins that may help prevent shedding. So before your surgery, we ask that you practice some post-weight loss surgery nutrition principles or eating behaviors that will help you be more successful with your weight loss. One of them is to practice not drinking with your meals. And by that we mean stop drinking any liquid 30 minutes before your meal. Don't drink any liquids while you're eating. And then wait another 30 minutes after you eat before you drink any liquids. This is to help keep you from getting too full before you eat and also prevent food from getting pushed down through your intestines after you eat. This will help you absorb and digest the food that you eat better. You also will need to increase your intake of hydration fluids to 64 ounces a day even before surgery, which will help you be better prepared for the surgery and prevent you from getting dehydrated right after surgery. You will also need to try and drink non-calorie, non-caffeinated, and non-carbonated drinks in order to wean yourself off of the caffeine that we don't want you to have right after surgery. Caffeine can be a diuretic, which can make you urinate more frequently. It can also increase gastric acid production in your stomach, which we want to avoid after surgery to help your stomach heal. You will also want to eliminate snacking or grazing throughout the day or eating in the middle of the night. You also want to maintain consistent eating times every 3 to 4 hours, which will help you keep your metabolism revved up, help keep your calorie burning rate up, and it will also help you obtain the nutrition that you need after surgery because you're going to be eating smaller amounts each time you eat. You also want to eliminate distractions while eating. So do not eat in front of the TV, while texting, while checking email, because that makes you distracted and not be able to know how much you're eating or how fast you're eating. It will help you after surgery to be able to monitor symptoms and signs of fullness, which sometimes can be very tricky and difficult to determine. It would be best to practice eating for a longer period of time, which means taking about 20 to 30 minutes to eat a meal. That helps you be more mindful of how much and how long you're eating, which helps you also with making sure that when the food gets to your stomach, it's already been pre-broken down in your mouth, and it helps your stomach digest food better. Along with that, you're going to chew your food to applesauce consistency, which helps your stomach digest the food better. You also want to decrease intake of high sugar and high fat foods, which will help you decrease the amount of calories that you're eating. After surgery, this is also very important in order to avoid dumping syndrome when you have gastric bypass, or to just avoid having some GI upset when you have the other types of surgery. You would also want to eliminate alcoholic drinks. You also would want to increase your protein intake now, because after surgery, protein will be the main star of your plate. It will be the main source of nutrition after surgery. I hope that you enjoyed our presentation today and that you learned good information that will help you prepare for surgery. Please let us know if you have any questions. And thank you for listening.